We're not done though with dopamine type 2 receptors because there are also D2 receptors in the pituitary, particularly anterior pituitary, regulating the release of prolactin. But it's not just dopamine on the scene. I have to move here. It is also serotonin. Well, there are two of them. Dopamine and serotonin are both magkaaway sila. They fight over how to regulate prolactin. See, when dopamine binds to the D2 receptor, when dopamine binds to the D2 receptor, prolactin stays put. See that? There you go. Prolactin is like, it's just, I'm just gonna stay here. But when
serotonin, I hate 3D matters. If I move further, when serotonin binds to the 5-HT2A receptor,
specifically the 5-HT2A receptor, prolactin is like, all right, let's go. There you go. Lots of prolactin. Now, what if the opposite were to happen? The opposite as in antagonists bind to the receptors. So a dopamine type 2 receptor antagonist and a serotonin 2A, 5-HT2A receptor antagonist binds to their receptors. What do you think will happen? Well, the opposite, basically. So, in short, dopamine itself blocks prolactin release, serotonin promotes prolactin release. Eh di kung antagonist, baliktad. D2 receptor antagonist promote prolactin release, serotonin 2A receptor antagonist blocks prolactin release. Right? That's why D2 receptor antagonists can cause hyperprolactinemia. So increase in prolactin, which does not sound really bad until you start talking about the consequences depending in men, in women. So for both, that's sexual dysfunction because prolactin apparently plays a role there. In women, that leads to menstrual irregularities and breast milk secretion. For men, the men think they are safe. No, they're not. For men, it's gynecomastia. Man boobs, basically. Man boobs. Yeah. And it doesn't stop there. For both men and women, prolactin can also affect bone mineral density, actually. For prolonged treatment, bone mineral density screening might actually be recommended for some. And for women, there are associations, unfortunately, with breast cancer risk. So this is not benign as it sounds, right? So still something to be mindful of.